Hello everyone and welcome back to medical speaking class. In this module, we talk about integumentary and musculoskeletal disorder or skin, joint, and connective tissue disorder. Well, in this video, I'll show you a couple of tips in communication with patients when they're presenting with skin or MSK problems. Alright, so let's talk about skin first. This is one of the key organs that we often look and we often forget. So, as usual, any dermatologic history always start with a chip complaint. So, why patient come to see you? Remember, chip complaint in skin is similar to many other medical problems. It could be a rash, it could be a bump, it could be something else that they concerning. So you also ask about past medical history, medications, allergy is so important, family history, any health-related behavior, or alcohol, drug user, they may have different weird skin findings. And then we do review system. Now, if you go more specific, the HPI in skin exam is quite different. So for example, you should ask when did it started? Does it itchy, burn, or hurt? So the key finding in skin is it's itchy, burn, or hurt. And when with the first episode, and where in the body the rash started, because that can give you some clue finding. For example, some viral condition can start in the back and then go toward the lower part or the part of the body, versus some contact dermatitis can start just locally in the hand, and based on history you can make a diagnosis. Now, how has it spread with the patterns? When it start from this point, go to this point, what would the pattern? Is that they still group together or they become diffusely? And then how the individual lesion change over time or evolutions. For example, it could start as a small papule or macules, but then eventually it becomes a vesicle. So in that case, you were thinking about some other conditions. So ask about evolution of the lesion of the skin is so important. Now, you also want to ask about what it make worse or what triggered the rash, right? So this is similar to the ochre we talk about. And then almost all the time when patients present with skin problem, they try something else, right? So just like you, if you have a rash, you're likely to do some over-the-counter cream before to see your doctor. So ask, what did you try? Because a lot of time, a mild type of steroid can give some response and can give you some idea. And you should know that a lot of steroid in the US, such as hydrocortisone, 1% is available over the counter. Now, for example, when you ask about rash history, you ask for any associated symptom, itchy, burning, or it hurt. And now any past medical history. And then remember, there's always a atopic triad: asthma, allergy, atopic dermatitis. Those usually come together with patient having history of allergies. Medication can cause rash, very common. And then travel history. And did you go somewhere recently? Did you go to a high pandemic area? Exposure something weird or environmental. For example, many nail worker Vietnamese may have some type of rash because they expose to certain chemicals. All right. And one thing about skin exam is there is total body skin exam. Well, when you do this, you basically examine the skin or the integumentary system from the top to the bottom. Remember, the skin include many things. It's not just skin, the scalp, hair, and nails, and also the mucous membrane of the mouth, the eye, anus, and then the genitalia. So there's many things that's not just skin, and oftentimes people forget to examine those regions. One thing you like to remember in a skin exam is a couple of hidden areas I really like you to remember is there's a concave bowl. So this is just the concavity adjacent to the external auditory meatus, which is right here. The auditory canal, which is right here, post-auricular creases, which is behind the ear. The medial canthi, which is right here in your eye here, and then the ala or the nasal groove, which is right here. Because a lot of times psoriasis patients, they may have a flak right here, and you don't see on the skin or the extensive surface of the joint. So a lot of times those hidden area can give you some clues. And also exam of the skin, of the scalp and hair sometimes give you some clue about lupus. So those are the things that you should remember when you examine your skin. All right, in communication with skin patient, this is so crucial. Why? Because the patient is going to be undressed. They're totally naked. I repeat, they will be naked. In order for you to examine every single thing of the skin component, the patient must be undressed completely, include underwear. Now, think about it. If you were undressed completely, how would you feel? Very awkward, right? If you see this is someone new or some stranger, even really awkward. So, whenever you examine the patient, you have to guide the patient, make some trust by be professional, polite, but also respectful. And one thing about a skin exam is be open-minded on what you see. I say that because sometimes a lot of doctors or students, when the patient exposed, they see a tattoo, they see something really weird, or some lesion or skin finding that really out of their mind. And they say, oh my God, what it is? You don't want to say that. You just keep it calm and open mind, because it is skin is benign. Okay, so be sensitive about your patient. Always wash your hand before touch the patient's skin, particularly in the patient's face. This is the lesson I like all of you to remember. Whenever you touch somebody's face or anything in the body, wash the hand. Wash your hand, because especially the face, nobody wants to touch someone else's face without wash the hand. And this is a lot of time when you examine the acne, you want to feel, you do it. One more thing about the skin is make sure it's enough lighting. Because if there's not enough lighting, you won't see anything. If you don't see anything, you cannot make any diagnosis, right? So those are the key findings on the skin, and make sure that you continue to reassure the patient what you like to do. Put a big gown and expose to the area that you interest only, and then cover the area you already examined. And when you go further, then you go back and mark what you're finding on the skin diagram. Now, the last thing about the skin exam is atrophy. Atrophy means what? Means the inner lesion of the skin. A lot of time we talk about skin, we see a lesion, something stand out, some bump, some rash. But indentation, it's something inside the skin, or we call atrophy. It can be a sign of a dangerous disease. So make sure when you observe the skin, make sure it's smooth, no bumps, but also no indentation. Okay, so that's something I like you to remember. Now we're going to move to a MSK or musculoskeletal exam. The history in the MSK exam is somehow similar to skin and also in general, but a couple of key findings in MSK is you should always think about functions. How does the patient function before the condition happen? For example, if they have joint pain, how did the patient did before the joint pain or after that? Because function is the number one issue will be impacted by MSK disorder. If you don't remember anything, remember function and MSK, and that will guide you the treatments. All right, and then in MSK, the symptom was a single joint, just here, or two sides, everywhere. Now, that gives you a clue whether it's local, just a shoulder pain, or it's systemic, like both sides, both hand, both foot, and both knee. Give you some idea. So think about functions, symptoms, just single joint or multiple, acute versus chronic. because the acute joint can give you some differential diagnosis versus something has been going for months or years that gives you some idea about a chronic systemic inflammatory disorder such as rheumatoid arthritis. Okay, and then you should ask yourself, what is the mechanism of injury? Because a joint pain basically is an injury to the cartilage, and when the bone touch to bone or the space in between is narrow, that causes a lot of pain signal to the brain, and that usually causes the pain. So think about what is the mechanism of injury. Is it autoimmune? So the antibody attack the cartilage, or this is a normal wear and tear like osteoarthritis, or this is because of trauma injury, or this is because of repetitive movement, so some work injury. So think about that mechanism of injury, give you some idea about the diagnosis, and also tell you how to treat that. In MSK exam or patient, you pay a lot of attention on observation. When the patient talks to you, look at the symmetrical of the patient. Is it symmetric both sides, or it's look like this, or this can give you a hint how the patient functions in that particular upper extremity or lower extremities. Okay, so look for sign of swellings, looking for sign of abnormalities or deformities. Look at the hand, is it look smoothly or is something weird? Look, and that one can give you some idea. Think about range of motion. Range of motions, was it normal or is it limit or it's stiff? Can the patient bend? Can the patient make a neck extension or flexion? So a lot of finding an MSK depends on the mechanism and those key questions you like to ask. In MSK patients, because a lot of time when you see the patient, they in pain, you like to make sure that whatever question or whatever movement you like the patient to do, make sure you don't induce a lot of pain or don't create more pain. For example, if they have synovitis, they have painful joint in their synovium or synovium, make sure you touch it one time and then it's okay. Don't do multiple times. Patient really in pain. All right, and also in this module, I'd like you to be familiar with some terminology like flexion, extension, abduction, and adductions. Okay, so basically flexion moving forward, extension opposite direction. This is abduction, this is adduction. So know basic finding and key findings when you describe. As I said earlier, gait observation is very important in MSK examinations, and symmetrics. Look at the knee, look at left or right, which one more swollen, look at the patient standing, you compare, is this one bigger than the other, and likely give you some clue. And then two things about MSK you should master as any type of doctor is you should know a knee exam in and out, because this is so basics. Even if you are a family doctor, you should know this. You should know the back exam, because lower back pain is one of the most common key findings in the US, and I'm sure in Vietnam and other proper countries or the world, back pain is so common. So make sure you know knee pain and back pain, and joint pain, hand pain. So those give you some basic findings. The MSK exam should come together with a neurology or neurologic exams, because the neuromuscular bundle usually come together. When you examine a patient range of motion, you also assess for strength, you also assess for sensation, assess for motor functions, and that come together and bundle that with the skin finding will make you a really nice skin, joint, connective tissue, and some type of neurology exam. All right. I hope you to give you some key findings or remembers about the skin, joint, and connective tissue modules. See you in class. Last thing, assignment for this week, I told you in class is we talk about joint pain or arthritis. There's over 100 of arthritis. So for your job, it's very simple to identify what type of arthritis. I will give you some clue now. As I said earlier, acute versus chronic, inflammatory versus non-inflammatory. Is it local or is it systemic? And that can give you some idea what type of arthritis. Okay, I will see you in class. Chào các bạn, tuần này chúng ta nói về khám da, cơ xương khớp và các mô. Khám da là một trong những loại khám bệnh mà chúng ta thường bỏ qua, hoặc là ít nhất là chúng ta không khám đầy đủ. Cái lý do đơn giản là rất nhiều lý do, rất nhiều lần chúng ta không có hỏi bệnh nhân đầy đủ, hoặc là chúng ta thường quên một số vùng trên da. Ví dụ như là cái phần bên trong lỗ tai chẳng hạn. Tôi quan sát tôi thấy có rất nhiều bác sĩ quên khám chỗ đó khi khám da, và phần bên trong mũi. Và quan trọng hơn là khi chúng ta khám da, nhớ hỏi bệnh nhân há miệng ra để khám bên trong miệng, tại vì bên trong vòm miệng cũng là một phần của da. Và khám tóc và những cái phần quan trọng khác đôi khi chúng ta lại quên. Một điểm quan trọng khi bạn khám về da liễu cho bệnh nhân là bạn phải rất là cẩn thận trong cách cư xử và hành động. Nhớ rửa tay và đừng có xịt quá nhiều mùi nước hoa, và đừng giữ cho mình một thái độ lịch sự, tôn trọng với bệnh nhân. Và khi bạn hỏi bệnh nhân cởi đồ ra thì bạn nhớ cho bệnh nhân một cái mền hay là một cái gì đó để họ có thể che lại, và nhớ là đừng có để họ đợi quá lâu. Khi khám da, một trong những điểm mà quan trọng hơn là phải có đầy đủ ánh sáng. Chúng ta nếu không đủ ánh sáng, có một số cái vết trên da hoặc là một số cái mẩn trên da chẳng hạn, cái màu nó sẽ không có trung thực, chúng ta không có mô tả đúng. Và điểm cuối cùng khi khám da là các bạn phải nhớ cách mô tả một cái điểm trên da như thế nào, và các bạn khi mô tả đó các bạn phải nhớ đo lại và theo dõi, và nếu được chụp hình. Đây là một trong những cái rất là quan trọng trong việc khám da. Và nhớ khi chụp hình là phải có sự đồng ý của bệnh nhân. Điểm cuối cùng khi khám da mà tôi thường hay nói với các bạn sinh viên và bác sĩ ở đây là các bạn nhớ nói cho bệnh nhân biết là chúng ta sắp làm cái gì. Nhất là khi chúng ta khám những vùng nhạy cảm như khám ngực, thì bệnh nhân nữ bạn nên nói cho họ biết bạn đang làm cái gì, để cho bệnh nhân nữ họ biết, để họ chuẩn bị trước. Đặc biệt là khám vùng sinh dục, những cái nơi nhạy cảm như vậy nên nói cho họ biết trước bạn đang khám cái gì. Phần còn lại chúng ta nói về khám cơ xương khớp. Thì cơ xương khớp là một trong những cơ quan và hệ mà thường tôi cũng thấy là các bác sĩ và các sinh viên y thường hay bỏ qua và không chú trọng. Điểm quan trọng nhất của cơ xương khớp là chức năng, function tôi nói rồi. Tại vì chức năng của người bệnh trước khi họ bị vấn đề cơ xương khớp như thế nào, và khi họ bị thì chức năng của họ bị ảnh hưởng như thế nào. Đây là những điểm rất quan trọng, tại vì cái chức năng đó nói cho bạn biết là bạn chữa như thế nào, và cái mục tiêu của chữa bệnh nó dựa vào chức năng đó. Quan trọng khác của khi khám về cơ xương khớp là các bạn xem cái khớp đau đó nó ở chỉ một bên, nó trong cái vùng nội địa thôi, hay là toàn bộ trên người. Tại vì cái việc xác định cái khớp đó ở một nơi so với nhiều nơi sẽ cho bạn biết là bệnh của bệnh nhân thuộc dạng thấp khớp nào. Một điểm cơ bản nữa là khi các bạn hiểu về bệnh thấp khớp, các bạn phải hiểu về cơ thể học rất là tốt. Các bạn phải hiểu tất cả các tên xương, cơ và biết nó nằm ở đâu. Việc hiểu về giải phẫu học sẽ giúp cho bạn biết cái chức năng của cái bộ phận ở chỗ đó. Và nếu các bạn biết rồi thì khi mà bị đau hoặc là dây thần kinh hoặc là chỗ đó bị đau, các bạn sẽ dễ hơn. Đây là những cái điểm cơ bản khi khám da và khám cơ xương khớp, và tôi sẽ hướng dẫn các bạn kỹ hơn trong buổi học ngày hôm nay. Xin chào và hẹn gặp lại trong lớp.